Jody Holtzman. I'm with AARP and the Thought Leadership Group, and I'm interviewing here
Britton
Bonnie Britton of Vidant Health. So Bonnie, you're the telehealth administrator. The question that everybody wants an answer to is, okay, we introduce new technology. How does it get cost out of the system? How does it improve the quality of healthcare? What's the experience that you've had so far?
Okay. Well, I've had 15 years of experience in the home telehealth arena, and most recently started a telehealth program at Vidant Health for post-discharge patients after they leave the hospital with heart failure, with cardiovascular disease and pulmonary disease. And we monitor those patients on a daily basis. Registered nurses monitor those patients, do an assessment, contact the patient, and then if needed, if they believe there's a medical intervention needed, they contact the patient's primary care provider through the electronic health record. And from that, we have seen an 81% reduction in hospitalizations as well as bed days during the 30 to 90 days of monitoring with those patients. The patient satisfaction level is extremely high. Patients are able to live at home and stay strong at home and really start understanding the correlation between what they do or don't do and how they feel. I see it as the patient sees their data, they feel the effect of that, and then they begin starting to make a change.
And what are the populations that you're doing this with? Are these all populations, high income, low income, Medicaid, Medicare? Who's like participating, and is there any difference across those populations?
Okay. Right now we're focusing on Medicare and self-pay and indigent patients. And the diagnosis we're focusing on are cardiovascular disease, all-inclusive, and pulmonary disease, all-inclusive, with a special interest on heart failure, acute MI, and pneumonia. Because those are the diagnoses that hospitals are going to be experiencing reductions in payment if their rehospitalization rates are over a certain level. And as far in the past, I've worked with strictly indigent patients and Medicaid patients, and I really have not seen a difference in the ability of the patients to learn to take care of themselves based on their payer source or their financial source.
So what are the obstacles that you're seeing, at least in your ecosystem, to this just even growing in greater scale, the use of telehealth and perhaps other types of technologies?
The biggest obstacle that we see at this moment is this is so early in healthcare reform that not all hospitals and health systems have embraced this. The early innovators are seeing financial positive impacts from that. One of the other barriers not to implementing telehealth but for moving the industry forward is the lack of integration between electronic health records and the telehealth vendor software, because in the future we have to be able to move that data wherever the patient goes, because really patients are the ones that own their data, not a hospital or a telehealth vendor or a primary care provider clinic.
So looking out into the future, you're optimistic that those types of issues will be solved? If we're here next year, how will the conversation be different? If we're here 5 years from now, how will the conversation be different?
Okay, from an interface perspective, I believe a year from now that we will have made great strides in that. I think in 5 years that is going to be intact across the board. I think from a financial perspective, particularly a reimbursement perspective, CMS has been very resistant to reimburse because most models of telehealth in the past have been home health agency based, where they have a prospective payment system and are already being paid for those services. And so it's really getting the mind shift and the data to be pulled from other parts of the healthcare sector to be able to take to CMS to help demonstrate to them how we can reduce the costs within Medicare.
Well, that's great. Thanks so much.
Thank you.